Jania Butler, and my presentation today will be on diabetes. So, what is diabetes? Diabetes is a chronic health condition that affects how your body turns food into energy. Most of the food you eat is broken down into sugar and releases into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to blood sugar into your body cells for use as energy. If you have diabetes, your body either doesn't make enough insulin or can't use the insulin it takes as well as it should. When there isn't enough insulin or cells stop responding to insulin, too much blood sugar stays in your bloodstream. Over time, that can cause serious health problems such as heart disease, vision loss, kidney disease. Here's what you need to know about diabetes. There are different types of diabetes. There are gestational, prediabetes, type 1 diabetes, and type 2 diabetes. Prediabetes. Prediabetes is a serious condition where blood sugar levels are higher than normal, but not high enough yet to be diagnosed with type 2. Approximately 88 million Americans, more than 1 in 3, have diabetes and they don't even know. Prediabetes puts you at an increased risk for developing type 2 diabetes, heart disease, or even could cause a stroke. Gestational diabetes. Gestational diabetes is a type of diabetes that can develop during pregnancy and women who don't already have diabetes. Every year, 2 to 10% of pregnancies in the U.S. are affected by gestational diabetes. Managing gestational diabetes will help make sure you have a healthy pregnancy and a healthy baby. Gestational diabetes occurs when the body can't make enough insulin during your pregnancy. This can cause type 2 diabetes later on after your pregnancy. During your pregnancy, your body makes more hormones and goes through other changes, such as weight gain. These changes cause your body cells to use insulin less effectively. A condition called insulin resistance, which increases your body's need for insulin. Type 1 diabetes. Type 1 diabetes is when your pancreas doesn't make enough insulin or makes very little insulin. Insulin is a hormone that helps your blood sugar enter the cells in your body where it can be used for energy. Without insulin, blood sugars can't get into the cell and builds up in the bloodstream. High blood sugar is damaging to the body, which causes many of the symptoms of complications of diabetes. Type 1 diabetes is usually diagnosed in young adults, but it can develop at any age. Type 1 diabetes is less common than type 2. Approximately 5 to 10% of people with diabetes have type 1. Currently, no one knows how to prevent type 1 diabetes, but it can be managed following your doctor's treatment recommendations for a healthy lifestyle. Managing your blood sugar, getting regular health checkups, and getting educated on proper self-management can help you maintain your proper blood sugar levels. Type 2 diabetes is a chronic condition that affects the way the body processes sugar. Insulin is a hormone made by your pancreas that acts like a key to let blood sugar into the cells in your body for use as energy. If you have type 2 diabetes, cells don't respond normally to insulin, which is called insulin resistance. Your pancreas makes more insulin to try to get cells to respond. Eventually, your pancreas can't keep up and your blood sugar rises, setting the stage for prediabetes and type 2 diabetes. High blood sugar is damaging to the body and can cause other serious health problems such as heart disease, vision loss, etc. My patient, Mrs. Jones, will be discharged today with a type 2 diagnosis. We will begin to educate for healthy management and ask any questions she may have. Hello, Mrs. Jones. Can you tell me your name and date of birth?
Hello, it's Janai Jones. My date of birth is January 29th, 1985.
Okay, so we will be discharging you today. I'm going to be your nurse. My name is Jania. We will be discharging you today. You have a diagnosis of type 2 diabetes. So we will be educating you on healthy management and answering any questions you may have.
I have a few questions.
Okay.
Can I live long with diabetes?
Absolutely. Type 2 diabetes, average life expectancy, and is about 74.8 years. And non-diabetics, life expectancy is about 75.19 years. So if you properly manage your diabetes, you absolutely can live a long life, just as long as a non-diabetic.
How did I get diabetes?
There are many factors that can lead to a diabetes diagnosis. Things such as overweight, physical inactivity, your body is insulin resistance, your muscle, liver, fat cells don't produce enough insulin, family history, things like that can put you at risk for diabetes, so for type 2 diabetes.
How do you know I have diabetes?
It's diagnosed by a blood test. So we do a fasting plasma glucose test or A1C test. In some cases, we do a random plasma glucose test. It's done by a blood test. That's how we determine if you have the diagnosis.
Okay. How will I know if my blood sugar is too high or too low?
We have something that is called a glucometer, which we will assist and we will educate you in using. It's called a glucometer, and it will measure your sugar. It'll read your sugar. Blood glucose is commonly considered high if it's higher than 130 before a meal or higher than 180 2 hours after a meal. However, most of the signs and symptoms of high blood glucose, which is hyperglycemia, don't appear until the blood glucose level is higher than 250 milligrams. There are many symptoms from low blood sugar as well, which is hypoglycemia, such as fatigue, difficulty speaking, dizziness. And how you would know that you have blood sugar, your levels would be 70 or below. Usually we consider that hypoglycemia. You would also have fruity breath, which is something that you want to monitor.
Okay.
If these things occur, you want to call your doctor immediately. So we will demonstrate how to use the glucometer. So we are going to, it's a prick of the finger, and it's a strip. We then put the blood into the strip, and the glucometer will read it. So I'm going to give you an example. So you want to wipe a few times just to make sure lotion or anything you may have on your finger is gone. These are the strips that go into the glucometer. You want to make sure the glucometer is on.
Mm-hmm.
And you want to prick the finger. So you slide this back, and then you push this button to prick the finger. It's just going to be a little pinch. Then you'll get the blood return. You might have to squeeze sometimes just to get a nice return. Then the blood goes in there, and it'll give you a reading of your blood sugar. 120. So that's a good level to have your blood sugar at. I would dispose of this, and then you want to have something of this nature that's puncture proof for a sharps container, and you can dispose of all your needles in here.
How often should I check my blood sugar?
Well, it depends on your treatment and what your doctor recommends, but I would recommend 3 times a day.
Okay. Is there anything I can do therapeutic-wise for my medication to help my blood sugar?
Besides your medication?
Yes.
Okay. Maintain a healthy diet. You can exercise, weight loss, non-smoking, no drinking. All these things can help contribute to healthier living,
Okay.
healthier blood sugars.
What medication will I specifically be on?
There are different medications for diabetes, such as diabetes pills or insulin. And then with insulin along comes an insulin pill, insulin pump, insulin pen, and a needle. So we will be discharging you today with the needle, with the insulin syringe, and I will also show you how to effectively use that.
Where do I store my medication and where?
Well, you can store insulin away from, you want to keep it away from heat and light. You can, if it's open, you want to keep it at room temperature. However, if it's not open, you want to keep it in the fridge. When I say room temperature, I say about 56 to 80 degrees. And you never want to freeze it. Don't freeze it. Because if it freezes, it doesn't give you, it doesn't effectively work.
Okay.
I will demonstrate. I will do a demonstration for you. I'll show you how to draw up the premixed insulin and how to administer the insulin so you can properly do it when you're home. Okay. So again, you want your alcohol swab. You want your insulin syringe, which is measured in units. You are being discharged with 10 units.
Okay.
So we have your pre-mixed insulin and your syringe that you will be going home with. This is measured in units. You will be getting 10 units, so you want to draw up 10 units. So you want to draw up 10 units of air first. You see the 10 units there. You want to stick it into the pre-mixed insulin, insert the air. Then you want to draw up your 10 units that you will administer insulin. And you can put it in the abdomen, the outer part of the thigh, and the outer part of the arm. Most people use the abdomen. So you want to wipe the area down with alcohol prep, and then you want to just kind of go in at a 45-degree angle and administer the insulin. Then you want to, you're not going to recap this. You're going to take this and you're going to dispose of this into the sharps container or puncture-proof container. So it could be a sharps container or a laundry detergent container. Then you want to store this premixed insulin at room temperature between 56 and 80 degrees Fahrenheit.
What are some foods that I should watch out for?
Pastas, bagels, they can increase your sugar levels. You want to manage and maintain healthy eating habits to control your sugar levels.
Can diabetes be cured?
Although there is no cure for diabetes, it is manageable. It is possible to have normal sugar levels, but it is a long ongoing disease. It cannot be cured. That you want to watch out for example, your feet. Type 2 diabetes causes damage to blood vessels and peripheral nerves that can result in problems in the legs and feet. Symptoms and signs of diabetic foot problems arise due to the sensation for nerve damage as well as the lack of oxygen. People with diabetes, they can step on a nail and not feel it. You can cut your foot and not feel it due to that nerve damage. So that's something that you want to continuously look at. Check your feet, make sure you have nothing stuck in it. Make sure you don't have any cuts, bruises, a nail stuck in it, anything like that. There are also community resources that will help you maintain and manage your diabetes, such as the American Diabetes Association or Diabetes Prevention Program. These are free tools that can help you reach treatment goals and better manage your diabetes. Are there any more questions you have for me?
No.
Okay. So you will be discharged today with your puncture-proof sharps container with your glucometer and your strips and your insulin, your premixed insulin, and your needles will be discharged today to properly administer and maintain your blood sugars at home. If there's any questions you may have, feel free to call, and we can assist you in anything you may need help with.
Thank you.
You're welcome.